Hi, my name is Ivan. Today I'm going to be demonstrating blood pressure.
In this video, I will demonstrate how to properly measure blood pressure. Blood pressure is defined as the force of the blood against the walls of the arteries and veins created by the heart as it pumps blood throughout the body. Blood pressure is divided into two different measurements, which include systolic, which is the pressure in the arteries when the ventricles of the heart are contracting, and diastolic blood pressure, which is the minimum pressure in the arteries when the ventricles relax. High blood pressure or hypertension is a condition in which resting blood pressure, either systolic, diastolic, or both, are above a desired or optimal level. High blood pressure can lead to a higher risk of cardiovascular complications like heart attack or stroke. This is why blood pressure is vital and should be frequently monitored to prevent that. In order to ensure an accurate blood pressure measurement, your client should be rested for at least 5 minutes prior to testing, in a comfortable upright position with feet not crossed, feet flat, as well as arms relaxed. Next, you want to use the proper cuff size. It should cover around 80% of the client's arm using the circumference of the arm in centimeters. There are cuff sizes ranging from infant to adult. A cuff that is too small will overestimate the reading. A cuff size that is too large will underestimate it. You will also be using a stethoscope. This tool will allow you to listen to the heartbeat and determine the client's blood pressure reading. In order to ensure accuracy, you need to have the prongs facing forward and in your ear. The stethoscope head will be placed on the brachial artery. To begin the procedure, first adjust the client's feet. Make sure their arms are relaxed and their back is straight. Next, grab the cuff and make sure you locate the arterial marker inside the cuff. This will help you place the cuff correctly on the client by aligning the marker with the brachial artery. Secure the blood pressure cuff snugly around the arm. Once secured, place the pressure dial on the cuff to keep it stabilized throughout the procedure. Using the alcohol swabs, disinfect the stethoscope prongs and position them facing outward. Dry the prongs and make sure they are facing forward. Adjust the chest piece to the on position prior to starting by turning it. Firmly place the chest piece on the stethoscope over the artery located on the antecubital space. Do not place your thumb over the chest piece when applying pressure because it could interfere with the reading. Twist the valve to a closed position and begin to pump the cuff to around 180 millimeters of mercury. Once reached, deflate the pressure slowly, between 2 and 5 milligrams of mercury per beat by opening the air exhaust valve on the pump. By taking a closer look at the gauge, you can see that once the cuff is inflated to 180 millimeters of mercury, you can begin to deflate the pressure slowly, at a rate of 2 to 5 millimeters of mercury per beat, and listen for the first Korotikoff sound. The initial sound will determine the systolic blood pressure and will sound clear and like a repetitive tapping. The second sound will be a soft tapping or murmur, followed by the third sound, which will be a loud tapping. The last sound will become less prevalent until there is no sound, which will determine the diastolic blood pressure. Once you have your measurement, you can refer to the chart to determine the client's blood pressure classification. The chart on blood pressure can help determine if it is considered healthy or if steps should be taken to improve the overall blood pressure. These classifications range from normal to hypertension. A normal blood pressure reading would be systolic blood pressure less than or equal to 120 millimeters of mercury and a diastolic blood pressure of 80 millimeters of mercury or less. Prehypertension would range between 120 and 139 systolic and 80 through 89 diastolic. Hypertension, which includes stages 1 and 2, would range from 140 through 149 systolic and 90 through 99 diastolic for stage 1. Anything greater than 160 systolic and greater than 100 diastolic would be classified as stage 2 hypertension. Understanding how to measure blood pressure and the information from each category will help identify the risks of possible hypertension. Living a healthy lifestyle can help prevent these risks and improve your overall quality of life.